Hi everyone, how are you doing today? So, I want to get to our next topic today. So, the topic is again from General Pathology, chapter number 2. This is mechanisms of injury and necrosis. Okay, so we won't get too much into necrosis today. So, we will discuss what are the things that cause injury to a cell, what is something called as reversible injury, what is something called as irreversible, and then we will mention necrosis and apoptosis, which are forms of cell death actually. So we'll just mention it in this lecture and we'll cover them in the detail in the next one. Okay, so let's get to it. And before that, if you need my email, here is my email for you. This is Dr. Samal Noria for you, your pathology professor. My email, if you want to reach me directly, please email me on drsamal@midlandeducation.com. And this is my direct email that you can use to send me your comments. And if you are facing any difficulty with any topic from pathology, or any other subject, if you want to discuss that. So I will be happy to help you out. So let's get to our topic on cell injury. So I did share this image with you in the previous lecture on, what happens to normal cells when they encounter some external stimulus. Uh, Today, what we want to talk about is what happens when cells are severely injured. That could be a situation where the stimulus or the external agent is such that it can cause cell injury, or the cell has been trying to adapt, but it has failed. Okay, so inability to adapt can lead to cell injury, or certain types of very injuring type of stimuli, they can lead to cell injury. So that's what we want to look at today. So what are these different causes of cell injury? So there are many causes that I have listed here. So all of these come from your Robbins textbook. So the important ones that I've highlighted here are hypoxia and ischemia. Why does the textbook say these are important? Because these are the most common ones also, right? In many of your exam questions, they keep talking about and asking you about hypoxia and ischemia. And if you do understand, these are two different words. Okay, they are related, but they are different, right? So hypoxia simply means less oxygen in the flowing blood, right? That is hypoxia. So can it cause injury? Yes, less oxygen means uh, glycolysis is going to be affected. Specifically, the aerobic part of glycolysis is going to be affected and cell is going to be injured. Yes, mitochondria also need oxygen, right? Ischemia, though, if you compare, ischemia is total loss of blood flow to the tissues. So this can cause more severe injury as compared to hypoxia, because in ischemia, the blood flow is gone altogether, right? So if the blood flow is gone altogether, so I mean, it also cuts off the cell's ability to activate the anaerobic type of glycolysis. So entire cell machinery comes to a halt if it is ischemia with no blood flow, and the toxins accumulate. There is no clearance because the blood flow is sort of blocked. Okay, so ischemia can cause more severe injury as compared to hypoxia. Both can cause injury, but ischemia is more severe injury. Okay, let's look at other causes. So genetic derangement. So we did mention yesterday that certain genetic mutations can lead to, for example, accumulation of certain misfolded proteins in the endoplasmic reticulum. That can cause injury, right? We'll talk a little bit more about that today. Chemical agents can cause direct injury. Chemical agents can cause, uh, something like cyanide or carbon tetrachloride. They can damage the cell membrane. They can damage the mitochondria. They can impact mitochondrial ability to, run the oxidative phosphorylation pathways, right? Immune reactions, another cause of cell injury. Infections, all the bugs, they can cause direct injury to the cell. Nutritional imbalance, physical trauma, of course, all of these can cause cell injury, right? So again, please remember, again, most important ones are hypoxia and ischemia. Okay, with that said, let's look at what happens during early stages of injury. So There is a way to learn this. There are a few concepts around here. So we'll start off by learning the easiest way. That's my goal first with you, and then we can learn the exceptions and the overlaps and the other gray areas. So, but let's begin by learning it in a very simple and easy way first. So the beginning or the early stages of any injury, you can say, are still reversible. What does it mean? Reversible means the cell is injured, yes, but it can be brought back to its normal state, okay, by some repair mechanisms or by removing the injuring stimulus, right? So it's the early stage, okay? You can compare this with like a chronic stage or a late stage of injury where we say that the cell now has gone into an irreversible injured state. Okay, so this is one of the simplest way that you should start learning from. Okay, so this is how you learn it first. So early stage is reversible, late stage is irreversible. Okay, there are differences, there are some similarities. We'll talk about all of that. Let's talk about the reversible stages of injury. Okay, so when the injury is there in the cell, but it is still reversible, what features would you see? So, what is the morphology of such a cell which has been reversibly injured? Okay, so I've taken a snapshot from your Robbins textbook here. This is important. So, these are two changes that I want you to remember. Okay, what are the two changes that you see in the cell during early stages or reversible stages of injury? Two changes, very easy to remember. One is called cellular swelling because water starts moving into the cell. So cell swelling occurs. The second one is fatty change. Okay, so fat accumulates within the cell. Fat accumulation or fatty change occurs especially in the cells which deal with a lot of fat. What is one such cell which deals with a lot of, when I say deal, I mean processes a lot of fat? That is the liver cells, isn't it? Right? So, fatty change is very commonly seen as a feature of reversible injury in the liver cells. Most of the other cells, epithelial cells, right? They undergo cellular swelling. Both of these features, you can say, are the evidence of reversible stages of cell injury. There are many MCQs. Repeatedly they ask you the questions around this concept on what are the features of reversible stages of cell injury or initial early on injury stages. What would you see inside a cell? So the answer is simple. So cellular swelling, it's also called as hydropic change. Hydro is water. Water has gone into the cell, right? Hydropic change or vacuolar degeneration. Where did this word come from now? Vacuolar degeneration, because so much of water goes into the cell, it also sort of ends up getting into the endoplasmic reticulum. Endoplasmic reticulum breaks into small bits and pieces, small sort of, vacuole-like segments. They pinch off from the endoplasmic reticulum. That is called as vacuolar degeneration because the endoplasmic reticulum is sort of undergoing some sort of degeneration here, and it is small vacuoles that it shows as, right? So that is called as hydropic change or vacuolar degeneration. So overall, the cell is going to be swollen up. Second feature that I told you is a fatty change. Okay, so we'll just learn it for now and look at some more details of how the reversible injury happens. Okay. So I've taken this picture again from your Robbins textbook, the latest edition. That's what we are following, right? So in this picture, what you see is they've shown you the mechanism of reversible cell injury due to hypoxia or ischemia. So if you look at this image here on the top, what you see is a blood vessel. This is an artery, and they have shown you a clot in the artery. So because of this clot in the artery, okay, what has happened here? The blood flow to the tissues is lost, right? So if the blood flows to the tissues is lost, we use the word ischemia now. So ischemia is what is happening to the cells or in that tissue, right, where this blood vessel was taking blood to. Because of lack of now blood flow, lack of oxygen, predominantly, what happens is the cell organelle that starts to suffer the most is mitochondria in the cell. Okay, so which process going on in the mitochondria needs oxygen? Oxidative phosphorylation, right? So oxidative phosphorylation, from your previous knowledge that this process going on in the mitochondria is responsible for making a lot of ATP, right? So if mitochondria do not have oxygen, this process starts to fail and the level of ATP starts falling down. Okay, it starts reducing in the cell. I think this is pretty straightforward and very easy. Okay, so what has happened? Blood flow stopped because of this clot. There is no blood flowing to the tissues. All of the cells in that tissue, they start suffering because of lack of oxygen. And the most cell organelle which suffers is mitochondria because that is the one using all of that oxygen, right, to generate ATP. So oxidative phosphorylation suffers in the mitochondria and it cannot generate any more ATP. Okay, so that is what is shown here with these red down arrows. This means the level is going down. Okay, so loss of oxidative phosphorylation leads to loss of ATP. Okay, now because of this loss of ATP, some of the predominant functions of the cell are going to be affected, which is the one most important cell function that is going to be affected because of loss of ATP in the cell. So the first enzyme, you know this, sodium potassium ATPase or the sodium potassium pump on the cell surface, okay, it will start to fail. It starts to get affected because it needs ATP for its functioning. So if it needs ATP for its functioning and we don't have any more ATP, so this pump starts to fail. Okay, what happens is you see how they've drawn this sodium potassium pump. So sodium is going out, potassium is coming in, but now if the pump fails, sodium starts accumulating within the cell. If sodium starts accumulating within the cell, and you know the concept, wherever sodium goes, water follows it, right? So if sodium is now, it has started to go in, accumulate inside the cell, water keeps following it. And because of this pump failure, a lot of water moves into the cell. That is primary reason why hydropic change occurs or cell swelling occurs. Remember, this is still reversible. Cell is still, it can survive, it can live, it can reverse all of this back to the normal. Okay. So this is not a permanent damage as of yet. Is the cell function affected? Yes, but not reversibly as of now. So pump failure causes water influx, cell starts to swell up, the endoplasmic reticulum starts to swell up, right? And the membrane of the cell starts developing what is called as these membrane blebs. They have asked all of these features in MCQ, so that is why I am stressing on these. So cell swelling, membrane blebs, ER swelling, all of these are features of reversible stages of cell injury because of failure of sodium potassium pump, because of lack of ATP, because of failure of oxidative phosphorylation. In this case, it is because of ischemia. So make sure you learn the entire story from the beginning. Okay. Another thing that will happen because of loss of ATP in the cell is detachment of ribosomes from the endoplasmic reticulum. You see what has happened? So detachment of ribosomes. So if the ribosomes are detached, like in very simple words, let's say, uh, the ribosomal function is affected. What do these help with? Why do we need these? They help with protein synthesis in the cell. So if the ribosomes aren't functioning because of lack of, again, ATP, protein synthesis in the cell fails. Okay, so this protein synthesis is shown as this down red arrow, which again means the level of proteins is going to be low in the cell. Okay, so the cell stops, you can say, making proteins now. Okay, let's look at another change that happens. Loss of ATP kicks in anaerobic glycolysis. And you know a lot of anaerobic glycolysis, if it kicks in, if it is activated, what will accumulate? It leads to formation of lactate or lactic acid, right? So a lot of lactic acid will start accumulating inside the cell. Would that mean the pH of the cell would start to reduce? Now the pH starts falling low, right? Numbers reduce when the pH goes low because of the acidic state of the cytoplasm now. So a lot of lactate or lactic acid in the cell is going to reduce the pH. Okay. reducing pH is also an important thing that you should observe here and know very well, because all of that, lowering of pH and acidity in the cell will lead to reduced cell enzyme activities. Okay, so this will affect functioning of many enzymes which function at a certain pH. Now it is reduced because of lack of ATP. Okay, and lack of accumulation of lactic acid also starts affecting the nucleus. Okay, you can add this here. So it can affect the functioning of nucleus also. So all of these are very important changes, and they have asked you all of these features of reversibly injured cell in a lot of MCQs. So all that I have mentioned till now are reversible features of reversibly injured cell. Okay. There are more features that we talk about when the cell is irreversibly injured. We'll get to that in a bit. Okay, so let's review what are the microscopic features of reversible cell injury. So the first one that I told you is cellular swelling. The second one that I asked you to remember is fatty change. So cell swelling is when small clear vacuoles within the cytoplasm, okay, and they sort of, I told you, sometimes the membrane forms blebs, and the endoplasmic reticulum can sort of break up into small, vacuole-like segments, right? So we call it hydropic change or vacuolar degeneration. Okay, with fatty change, so these are triglyceride containing lipid vacuoles in the cytoplasm, and I told you this is encountered in organs that are involved with lipid metabolism, specifically the liver. Okay, so if they ask you a question or somebody talks to you about fatty change in the liver, it is reversible. If somebody talks to you about, for example, epithelial cells in the kidney with cellular swelling, okay, again, it is a reversible change. Okay, both can be reversed back to their normal state. I hope this is okay, and this is very important. So I have also put up a picture of fatty change in the liver, because this image is very repeatedly used in a lot of your exams. Okay, so this is a section of liver, and these are all liver cells, and these empty spaces that you see here are fat. Okay, so because we have used HNE stain. HNE stain does not stain fat. It does not stain air. It does not stain water. It does not stain fat. So this is fat. If you are still doubtful that this is fat or something else, you can use specific stain for fat, something like oil red O, Sudan B, or there are many specific stains for fat if you want to identify and confirm. Okay, that I want to confirm that this is fat, so you can use those stains too. Okay, but HND stain does not stain fat. So just because it is empty and not stained gives us a hint to that this is fat. Okay, these are all triglyceride filled vacuoles inside liver cells. Okay, so this is an important image for your exam. So I would want you to look at a question now. So let's read this question together. Let's discuss this. So this is a 47-year-old with hypotension and sepsis from ruptured appendix develops multi-organ failure. Okay. At autopsy, kidney histology shows widespread cell swelling, fatty change, and preserved nuclei. Some cells exhibit plasma membrane blebs, but intact organelles. So just by reading the question, this is exactly what we've discussed in the last 10 to 15 minutes, that I think these are all, if you agree with me, these are all features of reversibly injured cell, right? So which of the following best describes this stage of cell injury? So they are basically asking us, uh, a description of, or which of the following options is a descriptive option for reversible stage of cell injury. Okay, so let's read the options and try to figure out the answer. Option A is irreversible injury with mitochondrial rupture. No, we already have talked and agreed that these are features of reversible, not irreversible. Option B says apoptosis with caspase-3 activation. So apoptosis is a form of cell death. Cell death is irreversible, right? So this is still what we agreed is reversible. So option C says reversible injury due to ATP depletion. So this looks like the correct option. Option D is fibrinoid necrosis of renal arterioles. So necrosis is another form of cell death. Option E says liquefactive necrosis. Again, necrosis is a form of cell death. So option C seems to be the correct answer for this question. Okay, so let's again, you can review this, and I have told you a few things. So ischemia is the most common cause of cell injury, and we have discussed the microscopic features of reversible injury. Okay, so we talked about the cellular swelling, fatty change. So please learn these important points. These are very important. These are repeatedly tested in your exams. Okay. With that said, what we can now do is talk about mechanisms of irreversible cell injury. Okay, so we've done and learned a few features of reversibly injured cells. Now we'll talk about what are the mechanisms and features of irreversibly injured cells, and we will try to figure out uh, when does reversible stage turn into irreversible. Okay, a lot of students ask me this question: is there a continuum? Because and our answer is yes, there is a continuum possibly, because we said early stages of injury are reversible and late stages are irreversible. So this is a process, this is an ongoing process. But the question would be, somebody would be very interested, when does reversible become irreversible? Is there a point of no return? Is there a specific point when we can clearly say that, okay, these are the features, now the cell is irreversibly injured? Answer is both yes and no. This continuum, this transition is not very clear, and it depends on other factors, depends on the type of cell, type of tissue, what is the cause of injury, how severe it is. It depends on many, many things. But we do know of a few things which, when happen, the cell cannot go back to normal. So we'll talk about those few things and we'll see how they connect to reversible stages of cell injury. Okay, so bear with me. Let's talk about this and I'll explain the continuum and this process of when reversible becomes irreversible more as we talk about this. Okay, so there are a few things to be discussed here before we get into that concept. So let's learn what the book describes as the mechanism of irreversible cell injury. Okay, so I've listed 4 points on the screen for you. So 4 points here on the slide. If you see, the number one says influx of calcium. Number two is mitochondrial damage. Number three is accumulation of oxygen-derived free radicals. Fourth one is membrane damage. Okay, so you might ask me, does influx of calcium not happen during reversible? Does mitochondrial damage, did it not happen? We just mentioned mitochondria had some issues with oxidative phosphorylation in the reversible stages. Then what is this again listed as a, why is this again listed as a feature of irreversible cell injury? Accumulation of free radicals, does it not happen in reversible? Does it only happen in irreversible? Membrane damage, we again just mentioned that certain membrane sort of disruption does happen in reversible stages. Then what is it, right? What is the point of no return? What is the difference, clear cut difference in reversible versus irreversible? So we'll talk about all of that. Okay, so let's look at this another picture that I have screenshotted from your Robbins textbook. So let's look at all of these four different sort of pathways, or you can say different mechanisms that lead to irreversible cell injury. So again, the first one, it says hypoxia or ischemia, radiation or any other injuring agent affects mitochondria, right? What happens to mitochondria when hypoxia ischemia happens? Loss of ATP and loss of all of the functions which are dependent on ATP for their energy and their functioning, they will fail in the cell. We just talked about this, right? Another thing that starts happening in the mitochondria is accumulation of free radicals because oxidative phosphorylation is fluctuating. You can say it's being affected. A lot of free radicals because of this injury start to accumulate inside the mitochondria. Free radicals, can cause direct injury to the lipids, proteins, nucleic acids. They can oxidize everything inside a cell. Okay. So all of this put together causes cell injury, and the cell can become irreversibly damaged and can die with a process called as necrosis. Okay. Is it similar to what we just mentioned in reversible? Looks similar, isn't it? So we just said hypoxia and ischemia causing reversible with cell swelling, sodium pump failing, the cell swelling up, the endoplasmic reticulum breaking up. Yes, we did. Uh, that happens during early forms, early stages of cell injury. Okay, if it keeps going on and on and on for prolonged duration of time, right? So time is of essence here now. Time is what matters here for some of the cells. Let me give you an example. Mitochondria. Let's talk about heart muscle cell. Okay, so cardiac myocyte. Uh, I don't know if you know this cardiac myocyte. So anyone who is if you have a patient with MI has happened. So loss of blood flow to the heart muscle has happened. It still takes 30 minutes for the cells to develop irreversible damage. So loss of blood, maybe there is an artery that is blocked. Loss of blood flow has happened, yes. It still takes, after that blockade, it still takes 30 minutes. The average is 20 to, I mean, like the range is 20 to 40 minutes, average is 30 minutes. So it still takes 30 minutes for those cells to become permanently or irreversibly damaged. So similar to that concept, so heart cells take 30 minutes, muscle cells may take hours, more hours, maybe like few hours time, right? So neuron cells, neurons in the brain, they might suffer in within seconds, right? So it depends on the tissue. It depends on what the timeline is. So, I mean, what I'm saying is, depending on the time and the tissue, it determines whether the injury would be reversible or irreversible. Okay, so we'll keep talking about this concept today. Another thing that can sort of injure the cell membranes directly is free radicals. This ROS is reactive oxygen species or free radicals, okay? Or any other injuring agent or direct toxins, bacteria, certain bugs, they can directly, viruses, they can directly damage membrane of the cells, right? So cell membranes are damaged. This is because of damage to the lysosomal membranes. So if lysosomal membranes are damaged, what will happen? What will leak out? If lysosomal membrane is damaged, what do the lysosomes have? Lysosomes have lysozymes. Lysozymes will leak out. Other enzymes will leak out. What will they do? They will destroy the cell, right? So those enzymes are pretty destructive, right? Why do the cells have those? Cells have those for a lot of functions. One of the important function is to kill bacteria, right? Okay. Another thing, these free radicals or these toxins they can do to the cell membrane is, of course, direct damage to the plasma membrane, and it gets ruptured. It will be, sort of you will see impaired transport functions, and cell contents might leak out of the cell, right? So if membrane is gone, what will hold the cytoplasm? It will leak out. So all of these lead to cell death because this is irreversible damage. These are features of irreversible damage. If the cell membrane is damaged, uh, the lysosomal membrane is damaged, everything will leak out. The cell cannot be brought back to life. So the cell dies, and the pathway is called as necrosis. Okay. There are more details. So please, let's learn this step by step. We will accumulate and learn all those details in the next few lectures. Okay, so let's keep going one by one, bit by bit. Let's look at another type of injuring agent to the cell which can cause irreversible cell injury. radiation and mutations. Okay, so radiation, for example, UV radiation, ultraviolet radiation, right? So we live in I'm with my family. I live in the Cayman Islands, right? The sunlight is the UV radiation is sort of very predominant, very intense here. The UV index can touch up to 10, 11, or even 12 on certain days, right? What does that UV radiation do to the cells? So radiation and mutations sort of, so radiation directly, let's talk about radiation. It can sort of cause breakage in the DNA. Okay, breakage in the DNA. DNA tries to repair itself. If it fails to sometime repair itself properly, right? The cell can acquire some certain mutations, right? So that is what is shown here. So radiation and mutations causing DNA damage, right? Whenever DNA is damaged, cell cycle arrest can happen, right? Or in certain cases, what happens is after this arrest, the cell might also want to repair itself, okay? If all of this fails, all of this cell cycle arrest and repair function fails, if the damage is too severe, another pathway of cell death is activated, which is called apoptosis. Okay, so radiation and mutations can cause cell death by apoptosis. Okay, we'll talk about this in very much detail in the next few 2 or 3 lectures. Okay, the last one in this image is mutations, cell stress, infections directly causing damage to endoplasmic reticulum. Let's take an example of how I think I did in one of the previous lectures talked about alpha 1 antitrypsin. It's a very high yield and repeatedly asked question in your exams. Okay, they ask you a lot of questions on its morphology, clinical features, its complications, associations, and most importantly, the mechanism of it, right? And by the way, there are many other diseases which also, present similar mechanism wise, right? So the mechanism of that disease is because of certain mutations, the proteins are structurally defective. They are misfolded. Whenever proteins are misfolded, they might accumulate within the endoplasmic reticulum, and accumulation of those misfolded proteins in the endoplasmic reticulum can cause certain pathways to activate. Those certain pathways which are activated can further activate cell death mechanisms, which is one of them is apoptosis. Okay, we'll get to a little bit more detail today with that unfolded protein response. Also, that is in one of my slides, which is coming up in another 2, 3 slides. Okay, so just wait for that. So what we discussed here is different injuring agents which can cause severe damage or you can say prolonged damage to the cell, and depending on what the tissue type is, how much time has passed, what is the injuring agent itself, how severely it has injured the cell. So the cell